Well, thank you. That introduction sort of described everything, so I'll just take questions and answers. Well, it's very much my pleasure to be here and to share some of the work that I've done and I continue to do. And as was indicated in my introduction, my home institution is the University of Arizona, which is in Tucson, Arizona, and I've learned most Canadians have been to Vegas or Disneyland. So I'll try to give you also another reference about where I am in Arizona. There. Okay, the first thing I'd like to do is to acknowledge my colleagues. It's very rare to me to be presenting myself because I feel like our work is so collaborative and it really is a joint product. And the photo at the top is our colleagues at the Hualapai tribe, which is in northwest Arizona on the edge of the Grand Canyon. And the folks on the lower right, in addition to myself, are folks from Navajo Nation. So these are the two tribes I'm going to be talking about today. So I wanted to make sure and acknowledge that they are here in spirit. And I don't know how many of you are familiar with Robert Alexei. He was actually a band leader working out of Fort McPherson, and he's actually written two books, two sort of autobiographies, and one's called Porcupines and China Dolls, and the other one's called Pale Indian. They're sort of out of press now, but if you have an opportunity and you're interested, I would encourage you to read those books. And the reason that I'm citing him here today is because he said in Porcupine and China Dolls that it's important to know what the people went through and where they came from and what they went. It's important to know the people and where they came from and what they went through. And I think that is oftentimes a initial step when you do community-based collaborative research, is to really understand your partners. And so one of the things that I like to do when I'm working with partners, and many of these partners I've worked with for over 25 years, is really understand where we're both coming from. There's a tendency in the academic side when you work in a community to know all about the community, to go to the community, to understand the community, yet you oftentimes don't reveal much about yourself. So I have worked to have my colleagues come to the university, to have them present at the university, and to see my world as well, because I think that's really what the partnership should all be about. So in revealing a little bit more about myself than was in that pretty extended intro, I wanted to say that I came into public health sort of from the back door, in the sense that I do not have a degree I don't have a master's in public health, I don't have a doctorate in public health, but I teach in a college of public health. I was actually trained in quantitative science, which I think people find interesting looking at the work I do now. So I initially started with degrees in biology and nutrition and biological anthropology. So you probably heard the word anthropologist and you thought, oh, she's a cultural anthropologist and this is perfectly aligned with what she does. But I actually had very little formal training in cultural anthropology. It was more around measurement and more biological anthropology. After I finished my master's, I worked in a museum. I worked for the Bureau of Indian Affairs in the US, which manages Indigenous affairs in the States. And it was from that work that I really realized that counting things and measuring things was not the whole picture, and that we really needed to use mixed methods and to combine the picture that you got from both qualitative data as well as quantitative data. I now am quite blessed in that I work at the University of Arizona. I teach an awesome service learning course I partner with the Navajo Nation communities so that I can bring graduate students to those nations, and they can work alongside the paraprofessionals in those communities and really understand the strengths and the challenges that there are in those communities. I also teach a course in Indigenous health and resilience, which again is a focus to really look at the assets. That's my mantra, is that we have spent a lot of time in Indigenous communities counting and pointing out the deficits, and so that we have kind of added insult to injury. If you look at the past historical experiences of Indigenous populations, that we are still doing it today by the kind of literature we put out and the kind of work we do, which does things like measure deficits and problems. to orient you where you are, the map, you can see where you are up here in Alberta, and I'm going to be talking about tribes that are down here in the Southwest. And so the inset here of Arizona, and Vegas is over here somewhere, just in case you've been there. The two tribes, so I have stars by all the tribes that I've worked with over the last 20, 25 years, and every tribe has its unique assets, and I want to honor that, not create this sort of pan-Indigenous perspective that we have about Indigenous people. And so this is the Wallapai tribe. That's a tribe I've worked in for the longest time. The Havasupai tribe, which is the next star over, that's a tribe that's actually in the bottom of the Grand Canyon. Has anybody ever hiked the Grand Canyon? Did you know that there was a tribe at the bottom of the Grand Canyon? So there's a tribe in the bottom of the Grand Canyon. So there are certainly some challenges in terms of getting resources. If you go there, you have to hike, take a mule, or take a helicopter. So it's, it has its own unique set of strengths and challenges. Over here is the Navajo Nation, which actually does extend into the next two states. This is the Four Corners area here between Arizona, New Mexico, Colorado, and Utah. So the Navajo Nation is huge and has on reservation, they have over 300,000 enrolled American Indians. Not all Navajos, some have married in, some work there, but it's a huge population, but the population is spread out over that large mass there. So that presents its own set of challenges in terms of getting services to people. How do people get into services, particularly if they don't have the resources to have a vehicle? How are those things managed? A lot of roads are not paved, so there's this time of the year, my nephews are constantly texting me, no school, mud day, because the bus can't get down the road. So I don't know if you know when you know anything about Indigenous populations in the States, but this is the Hopi community, which sits in the middle of the Navajo reservation, which has its own set of strengths and challenges in terms of buffering Hopi from outside influences, but also in terms of sort of having Hopi kind of surrounded by Navajos, which always hasn't been a positive relationship between those two tribes. Over here, I've worked with the White Mountain Apache, and I've worked with the O'odham tribe, which is down here, which again is very unique in that they share part of the US-Mexico border. So they are constantly involved in issues around border patrol. And if you go there, has anyone ever been to this part of Arizona? If you go there frequently, the border patrol is all over their reservation. So it almost has a sense of being sort of militarized. So all the tribes have their unique experiences. I'll be talking about Wallapai and Navajo, the big blue area. I wanted to give you a thumbnail sketch of those two tribes. This is the Wallapai tribe, the one that was kind of that V shape. And if you noticed on the V shape, it was all kind of irregular at the top of that shape. That's because the northern boundary of their reservation is the Colorado River. And there's about a little over 2,000 people living on that reservation. It's a 1 million acre reservation, so again, large part of land, small number of people. Most people live in town. There's one town, and the town has a store, a gas station, post office box, and a lodge. And the reason it has a lodge is because the tribe could not make a casino work because they are only 2 hours from Vegas, and nobody wanted to come to their casino when you could go to Vegas. So they have initiated a number of tribal enterprises, one being a river running company, so you can go down the Colorado River on the tribal company, and they also are the developers and owners of something called the Skywalk, which I think you guys have something similar in Jasper, but they are a tribe that created a skywalk over the Grand Canyon, which put them at great odds with the Sierra Club, but it's a sovereign nation, so it was their way of creating a clean enterprise and also a way for to have employment for tribal employees. The population is relatively young, with almost 50% of the people on the reservation under 18. And one of the reasons for this is because there are limited employment opportunities. A lot of adults move and in some cases take their children, or some places leave their children with their parents and grandparents. So it's a very young population with a lot of young people, oftentimes being raised by slightly older people. The Navajo Nation, in contrast, is a huge population, over 300,000 people living in the reservation. In contrast to the Wallapai tribe with their one town, the Navajo Nation essentially has 110 towns. Those towns are called chapters, so they're pretty small. They're a small gathering where there's a community center, there's usually a gas station and a post office, and that may be it. There may be a food store, it sort of depends. They're all developed at a slightly different level. The primary employers with the Navajo Nation are the tribe, the federal government, Indian Health Service, and there are coal mining operations on the Navajo Nation. In contrast to Wallapai, there are more adults, middle-aged, young and middle-aged adults, because there are more employment opportunities there. So although I'm not going to get into those kind of differences in the population dynamics, I think it's important to think about, if you're talking about family, health, and child development and those kinds of topics, to understand how often children are living in multi-generational households and how often their parents, who are really their providers, are maybe not there consistently. Generally the work, I think it's similar to here where people go off to oil fields and coal mines. I've learned from the Northwest Territory where people go on for 2 weeks and come back for a week. So it's that kind of a relationship. What I want to do is give you a little bit of a sense of how we've done a lot of our collaborative research in using a Danai educational philosophy. And that is the idea that the process of research is not linear. If you've ever written grant proposals, if you've ever had to write timelines about any of your work, you've probably done it in a line. You thought, this is the months, these are what I'm doing, and then I'm going to have it all done here. Or, I'm going to have implemented my intervention, or whatever kind of research you do, it's a linear thing. In Indigenous populations that I've worked with, the concept of everything being iterative, that everything is ongoing. We're never going to have finished. It's not going to be finished. Life is dynamic, and we're always going to be reflecting on our experience, our strengths, our challenges, and then moving forward again. So the Danai educational philosophy, which is really the philosophy that guides the instruction at Danai College, which is the tribal college on the Navajo Nation, starts off with Nisakis, which is the top one, which is thinking. So you're thinking, and this is not going to sound that different to public health strategizing. You're thinking about what the issues are. What do we want to address? You might think, what are our strengths and how do we want to promote them? Or what are our challenges and how do we want to address them? The next one, Nahae, is planning, and that is, okay, what are we going to do about it? And this might also be a phase where you would do what we would call in public health a needs assessment. Where are our strengths? What do we have going for us? Where are our resources? So that might be that preliminary data collection piece. Then Ina, directly transmitted, means living, and we've used it in public health to mean implementing. Now you're really going to put your plan in place. And then Sahasin is reflecting or synthesizing, and that's what we oftentimes would refer to as evaluation and next steps. So the idea is that once you've done that evaluation and next steps, now what are you going to do? Now thinking again, what have we learned? What are we going to do? And so this concept of we're not going to finish something, it's all going to be fixed and we're going to be done. The idea of learning and having it be an iterative process. So if you watch up on the top of the screen, I'm showing you what phase we're in an Indigenous inquiry model. What we know from Indigenous health research is that the literature abounds with deficit models, that we have counted everything that's going wrong. We have identified that the challenges are a lack of resources. We even kind of turn our tables sometimes to the victim and we say, well, these programs would work if people would show up. We have these awesome things, but people oftentimes don't show up for patient education, don't come for community education, and so we say, well, people don't show up. And then we start to lapse that into, it's probably transportation or childcare, but even when you resolve those problems, sometimes people don't show up, which probably suggests we're not that much fun, right? Because people would show up if we were more fun. We oftentimes, in the literature and a lot of public health approaches, we use what I call the patient to provider model. We're always doing one-on-one education and not maybe recognizing more the determinants. I purposely did not use the word social, the determinants of health, because we oftentimes don't look at the bigger context, whether that's social context, whether it's cultural context, and is it environmental context. So we oftentimes are too quick to say, oh, it's poverty, and that's why people aren't showing up. They don't have cars, they don't have anyone to take childcare. But I think there's a lot bigger picture going on than poverty. And the stress that is created by discrimination and an ongoing chronic stress in many people's environments really prevents them oftentimes from being able to access a lot of the health education programs that are out there. Even when a program is referred to as community-based, it oftentimes just does education by getting a group of people in the room and educating them. So we're still kind of using a didactic model of let us inform you. And oftentimes that's not a natural way of learning in Indigenous communities. And that modeling behavior and being in environments that are positive and model those positive environments might work out better. And that's some of the strategies that we've looked at. And are some of you familiar with the Shonekoff's work on toxic stress in child health development? It's the idea that children between the ages of about 0 to 5 or 0 to 3, that's a real critical time of brain development, and that it's critical what's going on for a child during that time. So although parents may think, oh, he's very young or she's very young, and although there's stress going on in the household, whether it's stress that's related to financial issues, whether it's psychosocial stress that sometimes escalates into violence or escalates into unhealthy coping skills with drinking or other kinds of substance abuse, there's a perception because the child's sleeping or he's there that he's not really being affected by this. Shonekoff's work, which is really an amalgamation of work that was put forth by the American Pediatrics Association, is that it's really those first couple of years that are critical in terms of brain development, and that having a social context that is positive interaction can really set a child up for being able to deal with stress later in life. And that it's having stressful brain development, which is high levels of cortisol, high levels of not seeing parents interact with you because your parents are distracted. And there's a concept in family or in child health development of sort of serve and return, how much you interact with the child and the child interacts with you. And that's huge in terms of setting up positive brain development for a child. And so if the parents are pretty distracted because they've got a lot of other issues going on in their life, that's a hard thing to do. And for a lot of young families, parenthood sometimes just happens. It isn't something that you thought and planned and said, okay, we're financially stable now, we can start having kids. And so it's not a real thought process like that. So thinking about how to incorporate or integrate more healthy coping strategies, more healthy, positive relationships is really the crux of the kind of work that I've been doing most recently. I didn't just flash on the scene with this stuff. I measured kids, I did food label reading, I did all that one-on-one education. But when I realized it wasn't really having much effect, that there had to be another picture here. So the idea of using an alternate paradigm, the idea of looking at strengths in communities. Working in the communities for more than 20 years, I see that as an outsider coming into the community, you can make a lot of visual observations that would suggest poverty, poor resources, and that would then lead you to making the next step, which they need more resource. They need more support for better resources. But now, having had the opportunity to work in the communities for a long time, I see that there's tremendous strengths and there's tremendous assets. And so we kind of launched on this whole effort, predominantly in the Wallapai community because it's a smaller community, easier to get large groups of people together. And we talked about what are our strengths. And if you start the conversation, people are usually pretty silent. Go, what are the strengths of the community? And they have so much heard the picture of high rates of diabetes, high rates of domestic violence, high rates of suicide, that it's challenging to flip your brain and think about all the awesome things that are doing here. And when there's too much silence, I usually say, well, how come you guys, it must be, why do you guys stay here? If you can't think of any reason it's good to be here. And then what comes out is really that social connection. My family's here. This is always where my family has lived. And this is my home. And so it's really caused me to reflect, since I have the opportunity to teach a lot of graduate students who are Indigenous graduate students, why during their academic process, when things get a little out of control in the academic setting, they always want to go home. They're like, yeah, I'm going to go home this weekend. And it's a sense that that really is your comfort zone, and that is critical. So there's something that's less tangible in those environments, those social environments, that is not only a social piece, but it's also that grounding in their cultural identity. And so reconnecting with their cultural identity, reconnecting with their people is critical, because non-Indigenous folks tend to go to university, tend to graduate from high school thinking, I did it, I pulled myself up by my bootstraps. And when you ask Indigenous students, which we did a study we looked at why did you graduate? I mean, studies are usually like, why don't people succeed? We wanted to say, why did you graduate? What got you through? And consistently, it was adults in their lives who had encouraged them. And it wasn't always just family members. Sometimes they would come home on breaks, and other people in the community, a band leader or somebody else in the community would say, oh, you're back from school, that's awesome, and they will always add in, we're really proud of you. So that sense that you're part of something is really critical, I think, to the strengths in Indigenous communities. We certainly know from observational data that you see that social cohesion when you look at ceremonies. Many tribes have something called restorative justice, where for first offenders, they meet with a group of community members and they talk about what they did and what they can do to restore their status in the community and move that way in terms of not being incarcerated. Certainly tribes come together with land and water rights issues. The Wallapai tribe had some major issues related to that skywalk that I was talking about, in terms of their ability to even get the tourists to the skywalk, because they had to drive across non-Indigenous land holdings. And they came out and they protested when the landowner who owned that land had broken the lease that he had with them, and they got themselves on state TV. So you could really see in a very visible way that social cohesion there. So we know that that's there in many Indigenous communities. The other thing that we know is that the cohesion is also evident intergenerationally. You see this with baby naming ceremonies, you see this with puberty ceremonies, which in many communities, particularly at Wallapai and Navajo, are very strong still. You see that when a girl is going through her puberty ceremony, it's not just her and her mom. It can be anybody. Anybody can come from the community who wants to see that young woman, go into the next stage of her life. And then there's a place in that puberty ceremony. It's about a 3-day ceremony, and every morning the girl gets up and runs to the sunrise, and everybody runs with her. And so there's that sense of, you're with her while she's crossing into another phase. Now, my nephew has told me, because my niece went through this, he goes, you can't beat her. You gotta let her be at the front. But I just thought that was, he must have told me that 3 times. You can't beat her. And so anyway, but it's that sense of you're just running, and anybody can come and run with her, which is really a strong, powerful message, especially at sunrise when, everything's pretty quiet. And we know that a lot of households are multi-generational households, which means that the kids really have access to a lot of adults, grandparents, aunties, uncles. In a lot of cases, older siblings will take responsibility for children. And so it's really a powerful kind of network that children can have if, in fact, the adults in that network are all sort of doing this positive relationship building with the children. And these are just a couple of pictures to give you some images of what I mean when I say the collective resilience and that strength. As I pointed out, this sense is much stronger during a ceremonial time. So the upper right there is actually my mother-in-law and my niece, and that's her That's her coming of age ceremony called a Canalda in Navajo. And it's awesome to have a niece that's going through it because you can take pictures, right? And it was interesting though, because I asked her and then she asked the medicine man. The medicine man said it was up to her, and that's part of her being an adult. Part of her, do you want this like this? And so I was very fortunate. This is a ceremony at the Wallapai Havasupai tribe. This one is actually from Supai, so it's the bottom of the Grand Canyon. This is part of the food preparation for the Canalda, for the niece. So you can see how everybody's involved. This is a 3-day ceremony where you only get like 3 hours of sleep each night because the ceremony goes on. So everyone's there. Everyone's there as part of the process. And then this is just showing that this social cohesion is not something just connected to ceremony. That these are just women getting together, making their bread on a hot day, and so they were all cooking outside. So it's a thing that's very pervasive in many Indigenous communities. Talking about the social cohesion, I have been introduced to Thomas King's work, which hopefully most of you know. He's actually from the US, but it seems Canada has adopted him. He's an Indigenous writer who has many claims to fame here in Canada. And I thought this story, which is out of this book, Traplines, out of this story called Traplines, was really a good metaphor for the concept of the strength of social cohesion. Once when my sister and I were fighting, my father sent us to the woods to get 4 sticks. 4 sticks apiece, about as round as a finger. When he brought them back, he took each one and broke it over his knee. He then sent us out for some more. When we came back with the sticks, my father wrapped them all together with some cord. Try to break these, he said. We jumped on the sticks, kicked them, put the bundle between 2 rocks, and hit it with a board, but the sticks didn't break. You kids get the idea, he said. And this is really the metaphor, I think, in Indigenous communities of that's where my strength lies. The strength lies in the fact that I am part of something bigger than what I am. And so what we did is we sort of have over the years been trying to identify Indigenous strengths. Although we've got this concept of the power of social cohesion. Anytime you're going to write a grant proposal or get anything supported, you're going to have more data than saying, isn't this cool? So what we did is we actually talked to American Indian elders, and we asked them questions about their own resilience. And we asked them about what do you credit your success that you have in life right now? Knowing that we all have ups and downs in life, where do you think your success is? And what was particularly positive about this project is because we do have American Indian graduate students, the students were able to ask the elders the questions, and also elders oftentimes granted the opportunity to videotape them. What we learned is that the information, we did qualitative data analysis, and what we learned was at the individual level, the first piece of advice is know your roots, know who you are, know where you're from, that cultural grounding, and practice your spirituality, and be accountable. If you tell people you're showing up for a ceremony or you're going to do something, and ceremonies, anybody participate in Indigenous ceremonies on any regular basis? It is awesome how much happens by text now. It used to be, a lot of phone calls or a lot of guessing, and now like the whole product, it's just awesome. I just think it's just awesome how much texting has made that process. You forgot to pick somebody up, you can get a text, where are you right now? Can you pick up this person? I just think it's a wonderful medium for people to keep those conversation or that communication going. As family, we see that those messages about being accountable family members and adults is there. That's what people felt like as elders was critical in their own upbringing, that they had accountable elders, and that those elders or those adults in their life were positive role models. They felt that elders or adults also had a responsibility to keep the environment safe for kids and to really be protectors. At other levels, at the community level, there was a strong piece of advice to keep culture strong and to share stories, tell the stories when it's appropriate time of the year, And because it's the way of keeping the concepts and the ideas alive and dynamic. And what's beautiful, if you read any of Thomas King's work, he talks about, the story kind of depends on the storyteller, but there's always that core story there that stays the same, and that's sort of the beauty of the story being a very dynamic thing. Some of the advice that they offered for kids were to stay in school and to make sure you connect with your elders and to know your roots and history. Advice for programs were to, when there are culturally grounded programs, to be careful not to ground your stuff in the making of things. There's a tendency when there are culture programs or culture camps for Indigenous kids to get very focused around the making of something, that you're making an item that is connected to that culture. And the adults were very clear that that's great, for the kids to know that stuff, but really they really need to know are the values of their culture, of the philosophies of their culture. And that's why the concept of when you go out gathering and you're showing kids what to gather in terms of wild food, not only talk about where you find the places and the food that you bring home, but what happened while you were out there gathering. And oftentimes gathering in the Southwest is done predominantly by women. So to talk to the girls that are out there for the first time or one of their few early times, it's like, what else was that? Besides collecting, those cholla buds, what else happened while you were out there? And they'll usually start by telling, oh, such and such fell in the cactus, and then such and such lost your shoe, and they start telling you, but what else happened out there? And to really get them thinking about how, I said, did you talk to the elders? And, and to get them thinking about the connection and to think about the philosophy and the values. Another study that we did, and I sort of alluded to this, is talked about high school graduation and why individuals graduated. Again, trying to figure out what are the positive strategies. I mean, we spend a lot of time in public health talking to the people that have the poor public health behaviors and trying to set them straight, but we're setting them straight. I don't know what's guiding us when we set them straight, because we haven't ever talked, or we rarely talk, to the people that make it. Are we talking to the people who do not become substance abusers? Do we talk to the people that do not become diabetics? Do we talk to the people who do graduate from high school? No, we're usually over here talking to the people that are struggling. So our strategy was, if we could learn the lessons, could those somehow be integrated into an intervention? So those were the questions we asked them. We asked about key elements that supported them in their achievement in graduating from high school. We talked about in-school experiences, out-of-school experiences, and at the same time, we did a nominal group census in the community and had community members. We actually had an advisory board that was guiding the project with the high school kids, and the community board felt like they wanted to contribute their perspectives on the cues in the environment that were helping kids to move forward in a positive direction. So with the interview data from the high school students, we really learned that it was all about family and community support. And moms reigned supreme here. It was mom that wouldn't let you sleep in. It was mom that made you get up, and that was really critical. But other adults were brought up as well. A sense of responsibility to the tribe. Not, I know I can do this. I know I can pull myself up. I can do this. Really a sense that a responsibility to the tribe. And that also a sense of responsibility to come back to the community and be a role model and to really teach culture and life skills to the kids. Not so much in Navajo, but at Wallapai, they don't have the resources to have high school in the community. So all the kids after 8th grade go off to high school. I know here in Canada you call it residential schools. In the States we call it boarding school. It's a little better than the old model in which you were sort of taken to the boarding school. The kids have some choices, and they usually figure out where they want to go based on the classes before them. They talk to the kids, they text the kids, they Facebook the kids, they figure out where they think they want to go. So there's a little bit more engagement in where they go, but all the kids from Wallapai go off to high school. And so that was where we did this particular project. So that idea of I need to come back, and I need to come back and be a role model. If I made it, I need to come back and be a role model. In the nominal group process with the community advisory board, they certainly started off by identifying all the community structures that we would think of as supporting Indigenous youth health. Things like the community gym and the playgrounds. They have a ropes course, like a challenge ropes course. If you know what that is, they built it with a grant, and it's a pretty awesome thing. Really builds on that strength of community, collective engagement. These kids are awesome in collective problem solving. Really, really good. 5 minutes? 3 minutes. Okay. And so these are some of the things that they pointed out. Some of the things that are more abstract were the community events, how frequently it was that the community could get together as a group, and how that constantly reaffirmed that they were a people that had survived. And some of these things, like it says La Paz Run. La Paz was a place on the Colorado River down in southern kind of California, between Arizona and California, where the Wallapais were walked. Many of the tribes in the states have long walk stories, and that's where they were walked. And they were down there for a long time. And when they were finally released, they were just released, like, go ahead and go home. And so they walked back. And so every year they reenact the walk back by doing a run. It's a relay run, and it's 300 miles. So you get your slot to run your 5 miles or whatever you're going to run, and they run it like all day long. So sometimes your slot is at 3 in the morning at this spot. But it's a very empowering, collective kind of thing when it's all done. And then at the end, they all wait at the end, and then everybody runs into the community together. So it's a very, rich thing. We've done some youth and family camps that have also, I won't go through each thing, I'll let you read them, but one of the things that we've done at the camps is really, again, try to reinforce this collective engagement. The picture at the top is kids problem solving. That log that they're standing on is about to be raised up, and so it'll be swinging. That's why they all have helmets on, and they have to get themselves in a particular order without hitting the ground. So they're kind of like thinking about what they need to do there. And so sometimes they put themselves in order by their height. Sometimes they put themselves in order alphabetically by their first name. And so everybody has to be really strong and let somebody kind of walk across you so you don't fall on the ground. So it's those kinds of activities to show the kids how strong they are together. And then each kid has its own strengths. I mean, sometimes the big kids that can stabilize things are awesome. And sometimes these little kids that you don't think of as your ringers are the really cool kids that you can move around a lot. So it's really a positive environment there. We're looking at the kids that went to camp and the kids that did not go to camp. And that's a longitudinal evaluation project in which we're trying to figure out if those kids are more likely to do well as they get into high school. But the camp's been going about 10 years now, so the kids, everybody, you can start when you're about 8 or 9, so kids are just now starting to come out to high school. We did a radio drama where kids developed stories to show a fictitious family, probably trying to make some healthy changes, again building on those family strengths and assets. And this is what was so enlightening, because the kids are right on with the things their parents say to them, the things kids say to their siblings. And this was a way of also getting out into the community, because we used the tribal radio channel to broadcast those stories. So that's a project that it had its life, and we learned a lot of lessons. Like writing a radio drama feels a lot like going to school. So we are going to have to figure out how to do that better. But it was a stab at having the youth empowered to sort of move the community forward. I probably reiterated a lot of these things, but the idea that, I'll tell you what my challenges are now, because obviously there's always work to be done, right? We're always in that circle. And the idea of, if there is social cohesion and there is collective resilience, this idea of we can get through this together, how do you measure that? How do you figure out that your projects are really moving the community forward? And we tend to always want to count things in public health, like how many kids interact with the legal system, how many substance abusers are in rehab. And that's not what we want to count. We want to count positive things. So we're really struggling with how you track when a community moves forward in a positive way without just counting the negative things. I think I will, this is sort of what I've been doing here, is qualitative data collection with communities here in Alberta, and mostly, to be honest, in Northwest Territories outside of Yellowknife, because those communities really got this concept of, because they're small, cohesive communities, they really were interested in this concept. So we talked again about structural things, community wellness programs, adult education, culture in the classroom, but those more culture and social assets around how elders are engaged, how men are engaged with youth. I was really blown away by the adult men regularly playing hand games in the community, for the community to show up and interact, and to sort of teach the boys, not by saying like this is how you hold the drum and this is how you do it, or this is what you do with your hands, but just teaching through modeling. And the kids kind of float in and out of doing that, and so it's a repetitive kind of serve and return process of interacting with a man, and not just your dad, all the men that are playing there. So it's a really, building on those tight social networks. And this is where I am right now, that I'm working with First Nations and Métis communities in Alberta on a Canada Institute of Health Research planning grant around suicide prevention. Isn't that the case when the funding opportunities are always grounded in the negative? And then the other thing is with the Public Health Agency of Canada grant on that one's particularly related to domestic violence. So that's where I am right now. That I was only here for 4 months, and I'm about ready to leave, but we'll clearly be going back. But the idea of how could some of my experiences be integrated into opportunities that might work in these communities. So that's it. I don't know if I made my deadline, but this picture I think is awesome. This was Head Start at Wallapai, and I think it sort of demonstrates the importance of having, responsible adults interacting with the kids, and so that's the end of my presentation.
Thank you, Dr. Teufel-Shone, for your wonderful presentation. Unfortunately, we only have
I knew that was going to happen.
5 minutes for
Okay,
a question.
that's pretty good.
Question session. Does anybody have any questions to start? Well, I guess
Okay.
I can start that.
Okay.
I guess my question is, your research is based on that smaller
Wallapai, yeah.
Nation. So how does that kind of relate to, like, if you go into like a bigger nation like the?
Well, that's what we've done. We've done with the Navajo Nation.